There are 1.1 million Americans living with HIV/AIDS. For many of them, their best treatment option is HAART. HAART, or Highly Active Anti-Retroviral Therapy, is a regimen used by 54% of Americans infected by HIV. It is a cocktail of multiple drugs used to combat the virus. HIV is a retrovirus with an RNA genome. This must undergo reverse transcription using reverse transcriptase to create DNA from RNA. The newly formed viral DNA must integrate itself into the host cell's DNA via integrase. Proteases need to break down proteins with the cell, cause the HIV to transmit from an immature polyprotein to an active virus. The drugs in HAART target multiple enzymes in their respective stages in the life cycle to combat the virus. Integrase is an enzyme which splices the transcribed HIV genome into the DNA of the cell by creating a binding complex called an intrasome. Raltegravir is the most common integrase inhibitor. It works by blocking the binding site. HIV-1 protease envelopes and cleaves the polyprotein into separate proteins needed to make the mature form of HIV. Protease inhibitors such as indinavir and saquinavir bind to the active site blocking the polyprotein. Since the protease inhibitors are more stable than the polyproteins, they remain inside the protease and stop it from cleaving polyproteins, resulting in a permanently immature HIV virus. The reverse transcriptase enzyme is comprised of polymerase, shown in pink, which creates DNA from RNA subunits, and nuclease, shown in blue, which cleaves the RNA. Nucleoside reverse transcriptase inhibitors such as AZT are modified nucleotides that are able to be inserted by polymerase into the DNA nucleotide chain. However, successive nucleotides cannot be added to it, ceasing DNA formation. Non-nucleoside reverse transcriptase inhibitors such as nevirapine connect to the allosteric site of polymerase and cease DNA formation. Why the cocktail? Reverse transcriptase commits errors very frequently, so the virus can mutate and develop a resistance against a single drug. How has HAART changed HIV treatment? HAART allowed patients to move away from multi-pill regimens. It requires just 1 or 2 pills a day. It has few side effects and can work for decades without changing treatments. HAART is so effective that it can reduce the viral load to undetectable amounts. This will not cure the infection, but it will keep it under control.